Hello, I'm Dr. Jerry Tunnett speaking to you from my office in the Dallas, Texas area. Macular degeneration has become a major problem in our country, with millions of people going blind with no significant treatments for it. Most ophthalmologists feel that macular degeneration is not treatable. However, we've figured out how to treat macular degeneration, and in most cases we can restore normal vision in a very short time. In this video, I'm going to explain to you how we're able to finally reverse the blindness caused by macular degeneration. In addition, we'll be discussing how we're able to lower eye pressures in people with glaucoma, how we're able to eliminate uveitis in most patients, and how we can reverse early cataracts.
Now let's look specifically at the treatment of macular degeneration. The macula is the concentration of color light sensitive nerve units called cones, where light normally focuses in the back of the eye. When these light receptors begin to die, the condition is called macular degeneration. Early in the process, the pigment behind the retina begins to form clumps. Next, the dead cells are replaced by scars called drusen. These scars, like plaques in arteries, are made up of calcium, cholesterol, and fibrous tissue. Since no fluid is involved, this stage is called dry macular degeneration. As the voltage in the retina drops, oxygen levels drop. The decreased oxygen levels stimulate new blood vessels to grow into the area. These new, fragile vessels can bleed, causing new damage. This is called wet macular degeneration. This image is a cross-sectional view of the macula with a test called OCT. What you can see is the fluid underneath the retina that is formed from leakage from these new fragile blood vessels in wet macular degeneration. Both dry and wet macular degeneration are caused by the inability to make new cells that work. To make new cells requires all the raw materials necessary to make a cell and the voltage to use those materials. One must also turn on the craniosacral pump to help nourish the retina. Since the retina is 50% cholesterol by weight, one must not take drugs that prevent the liver from making cholesterol. The incidence of macular degeneration appears to have increased significantly since statin drugs were introduced. These drugs only help 1 out of 2,000 people that take them, so stopping them does not significantly increase the risk of having a heart attack, but greatly improves the ability of your retina to make new cells and heal. The end result of macular degeneration is scarring. Our therapy is able to stop the progression of cell death in most cases, but is not currently able to overcome scarring.
With this device, we are able to take a cross-section image of various parts of the retina and the optic nerve. The result is something similar to a CAT scan in that we're able to see a cross-section of the macula and see which cells are damaged and what else is going on in that area, and whether or not there's significant scarring there. In addition, we can take a cross-sectional image of the optic nerve and get a good estimation of how much damage, if any, has been done from glaucoma. One of the things that's essential to accomplish in treating macular degeneration is to restore the voltage in the retina. This is most easily accomplished by this type of device, where we have a specific unit that puts the energy back onto the retina, and specific frequencies that are necessary to transfer the electrons from the device to the cell membranes in the retina. This process takes about 15 minutes per eye, and we treat once or twice a day.
If the starting vision is 20/70 or better, we get most people back to 20/20 or 20/25 in 1 week. If the starting vision is 20/80 or worse, we rarely get back to reading vision, which is 20/50, because there is too much scar to overcome. However, we usually are able to keep what vision you have instead of it continuing to get worse. How long the correction lasts is often a function of whether you continue to take the nutrients and whether you have a dental infection. Now let's take a look at the treatment of glaucoma. Glaucoma traditionally means that the pressure in the eye is low enough relative to the circulation into the eye to keep the nerves nourished. When nerves are damaged, the size of the cup of the optic nerve increases as nerve fibers die. In the diagram, you can see a normal cupping in the nerve in the left, but glaucomatous cupping in the nerve in the right. Although most physicians feel that the outflow channel for fluid from the eye is part of the venous system, I personally believe that high eye pressures are due to obstruction of this system and that it is part of the lymphatic system. This also backs up protein waste, and these toxins also damage the nerves. Here you can see a diagram of how the lymphatic fluid flows from the eye down to nodes in front of the ear called the parotid nodes, then around behind the ear to a node called the water wheel, and then down the submandibular nodes into the neck and eventually into the venous system just behind and below the clavicle.
Traditionally, it's believed that the outflow channel for fluid in the eye is part of the vascular system. However, I've come to believe that it's really part of the lymphatic system. And so, lowering pressure in glaucoma involves, among other things, getting the lymphatic channels to drain correctly. Now, in the face, particularly from the eyes, the lymphatic drainage goes from the eye to in front of the ear, to behind the ear, and then down a channel this way, and eventually into the venous collection vessels here in the upper part of the chest. And so if you're going to lower pressure in glaucoma, you have to be sure that all of these channels are open. So in glaucoma, it's necessary for us to open them. And we began by pressing on the areas where there are lymph nodes to help express those and be sure that they're open. And of course, we have to open the final common pathway here by pressing into the neck like this to open the distance between here and here. And then we open these nodes, open the nodes behind the ears, open the nodes in front of the ears, and then we can begin to open the rest of the channels. And so we're able to do that electronically with this kind of an effort. So what we would do is we always began down at the lowest part, and so we began to open this part of the channel, and we can do it electronically. And once we do that on both sides, and then we just begin to work our way up and be sure that that's open, and be sure that it's open to behind the ear, and then that it's open from in front of the ear to behind the ear, and then eventually from the eye to in front of the ear like this. So once we open this channel area, we began to increase the outflow of fluid from the eye and thus lower pressures in glaucoma. Now there's another thing that's necessary to do, and that is to turn on the cranial sacral pump. There is a pump inside the brain and spinal cord called the cranial sacral pump, and it's the purpose of this pump to move cerebrospinal fluid around through the entire nervous system, particularly the brain and the spinal cord itself. Now this pump also has another function, and that is that it helps pump fluid out of the eyes, ears, etc. And so it's important in glaucoma in particular to have this pump working. When the pump is shut off, then you lose that pumping action to help remove fluid from the eye. It's also important in general health and in other things like macular degeneration as well, but it's of utmost importance in the lowering of eye pressures from glaucoma. Now, fortunately, we can turn this pump back on with an electronic approach. So there's a particular spot here on the side of the neck that is an acupuncture point, and when we put energy into that particular point, it turns the craniosacral pump back on. And in almost all patients who have glaucoma, that pump will be shut off. So we simply take the electronic device, put it on the side of the neck like this, and bring the power up, and then hold it here for 1 minute, and then we repeat that on the other side of the neck, and after doing that, the pump begins to work again. Often just turning on the pump itself will lower the eye pressure by several millimeters of mercury.
Inside the brain and spinal cord is a pump called the craniosacral pump, intended to move several spinal fluid around through the brain and spinal cord. This pump is diagrammed as you can see here, but oftentimes the pump gets shut off, and we can turn it back on by stimulating the point identified in the center graphic where you see the black star with the yellow center. This actual point is an acupuncture point called small intestine 16. Stimulating this point electronically allows us to turn the craniosacral pump back on. With the treatments that we are suggesting here, we can often get rid of some or all of your medications that you normally use for glaucoma, and this is generally accomplished within a week or so. How much vision is restored in glaucoma depends on how much scarring there is in your optic nerve. How long the correction lasts is often a function of whether you keep taking the nutrients, particularly those that keep your stomach acid present, so that you break down proteins you eat into amino acids. Undigested proteins often clog up your lymphatic system, and uncorrected hypothyroidism often shuts down your craniosacral pump. I often get calls and emails asking me to refer people to ophthalmologists in their local area who know how to do these kinds of treatments. At this time, I have not trained other doctors how to reverse macular degeneration, lower eye pressures, and help eliminate uveitis. Perhaps that can happen in the future. However, at the present time, you can come to Dallas for treatments. You can call 972-580-1156 to contact my office, or you can email us at info@tenetinstitute.com for details. In addition, I've written a book called Healing is Voltage, Healing Eye Diseases, and it talks in more detail about these techniques. The book is available from my website, or you can also order it on Amazon. Thank you for watching.